For 5 parts, I've given you the clean story. The molecule, the trucks, the pile-up, the tests, the tools. But the clean story is never the whole story. This last part is the honest truth, the edges, the debates, the things we're still figuring out. Because being genuinely hard to fool means being comfortable with nuance. Let's start by paying off a promise. Back in part 2, I told you good cholesterol was a myth I'd come back to. Here it is. HDL, the cleanup crew that carries cholesterol back toward the liver, really does correlate with lower risk. So the logic seemed obvious. Raise it with drugs and save lives. So they built the drugs. Several of them, over decades, for billions of dollars. And one by one they raised HDL beautifully, but failed to reduce cardiovascular events. One raised HDL dramatically and increased harm. The HDL cholesterol number, HDL-C, turned out not to be a reliable treatment target by itself. Even stranger, people with very high HDL aren't necessarily protected. In some large studies, very high HDL is associated with higher risk, not lower. It turns out it was never mainly the amount of cleanup crew that mattered. It was how well the crew actually works, and the number on your panel barely captures that. Good cholesterol was always a slogan, not a truth. And that's your first real tool for not being fooled, the difference between a marker and a cause. HDL often marks risk, but raising the HDL number hasn't proven to be a protective lever by itself. Lowering the trucks, apoB, was cause. Raising the crew was mostly correlation wearing a nice label. Learn to ask which one you're looking at, and half the health myths on the internet fall apart. Here's the same lesson from a different angle. Remember triglycerides, the fat your trucks also carry. High triglycerides genuinely track with risk through cholesterol-rich remnant particles that lodge in the wall much like the trucks do. So drugs that lower triglycerides should help. Some do. And some, tested honestly, simply don't. One major drug lowered triglycerides by 1/4 and prevented nothing. A purified fish oil drug lowered them and did help, but a similar-looking omega-3 strategy with a different formulation and trial design did nothing at all, and the field still argues about why. The honest lesson: lowering a number is not the same as preventing an event, ever. This is why real scientists are cautious in a way that can sound frustrating. It lowers your cholesterol is not automatically it saves your life. Anyone who collapses those two, to sell you a supplement, a diet, or a fear, is skipping the exact step that honest medicine refuses to skip. Now, a fear I promised to face honestly. Can lowering cholesterol go too far? People born with a weak bouncer from part 3 can have lifelong low LDL and much less heart disease without an obvious major safety signal. And trials that push LDL very low have been reassuring too, over the follow-up studied. But honesty cuts both ways. We have superb data out to about 5 years, and less certainty about the effect of extremely low levels sustained across many decades. So the fair statement isn't, we know it's perfectly safe forever. It's, the evidence is reassuring, the benefit for high-risk people is real, and we keep watching. That's what honest looks like. There's another whole layer we've barely touched. Cholesterol was never the only driver. Even with the trucks fully handled, some people keep having events, because the artery wall is also inflamed. And when researchers used a drug that cooled inflammation without touching cholesterol at all, events dropped. Proof that cholesterol is a huge part of the story, but not all of it. But here's the nuance that makes it real science and not hype. Not every anti-inflammatory works. One common one was tested and did nothing. It has to be the specific inflammation pathway inside the plaque. A cheap ancient gout pill happens to hit it, and in selected high-risk trial populations it reduced cardiovascular events. It's now labeled for that use in specific adult patients. Other anti-inflammatory drugs have not shown the same cardiovascular benefit. Specificity is everything. And then there's you, because none of this is one-size-fits-all. Your biology isn't the trial average. A woman's cholesterol jumps at menopause, and she's more likely to be undertreated, not less. Some ancestries carry far more of that hidden LPA particle, or may need different dosing considerations for certain statins. The science is universal. The application is personal, which brings us to the most uncomfortable, honest truth of all. The biggest problem in cholesterol isn't a mystery we haven't solved, it's that we don't use what we already have. Half of people quit their proven medication within a couple of years, others can't afford or access it. The frontier isn't only in the lab, it's in the follow-through. And a lot of that follow-through was lost to exactly the kind of myth this series exists to dismantle. The muscle scare from Part 5, the "it's just clogged pipes" from Part 3, the "good cholesterol we just retired." Fear, dressed as knowledge, talked people out of protection they may have needed. That's the real cost of being easy to fool. So step back and see what you've actually built. You can tell the molecule from the delivery system, the number of trucks from the cargo they carry, a marker from a cause, a biomarker from an outcome, a population average from your own body, and a confident slogan from honest, tested science. That's not trivia, that's immunity. That was the whole point. Not to hand you a slogan to repeat, the world has plenty, but to inoculate you, to build the antibodies so the next scary headline, the next miracle cure, the next "they're lying to you" can't infect you. Because a person who understands the system can educate themselves for the rest of their life. Cholesterol was never the villain. It's the molecule that builds you, hijacked in excess over a lifetime by a delivery system we finally understand. And now, so do you. Not the slogan version, the honest one. That's the difference between being told what to think and knowing how to think it through. If any part of this made the world a little clearer, that's what this whole channel is for. Neuro Synapse Studio exists to hand you the understanding, not just the answer. Subscribe, share this with someone who's afraid of their cholesterol, and come learn the next system with us, because the best defense against being fooled is understanding, and you just earned some. Subscribe and share this with someone who's afraid of their cholesterol. Understanding is the best defense against being fooled.